Our topic this week has been screening for risk related to alcohol and other drug use, the delivery of brief interventions to people assessed at being at moderate risk of harm, and referral to treatment for those people at high risk of harms who are probably dependent. We identified the need for opportunistic screening and brief interventions because people often lack insight into their drug use and will not seek help until more serious problems develop. The aim of screening and brief interventions is to stop those more serious problems from developing by encouraging the individual to take action to reduce the level of risk. We covered some of the approaches to screening and the principles of effective brief intervention, including consideration of the stages of change model and how to approach motivational interviewing. Despite evidence for the effectiveness of screening and brief interventions, implementation of such approaches is far from widespread. We identified some of the barriers to implementation in the last section. In our centre at the University of Adelaide, we are continuing to work on delivering training in screening and brief intervention. We have been involved in work on behalf of the World Health Organization to develop the Alcohol, Smoking and Substance Involvement Screening Test, or the ASSIST, a tool for screening for risky use of alcohol and other drugs. We're currently trialling a brief version of the ASSIST for delivery via tablet computers. We hope this will support uptake in busy settings such as the emergency departments of hospitals. I encourage you to think about the issues discussed this week in reflecting on risk behaviours and early intervention in the self-assessment component. Next week, we'll consider interventions to manage withdrawal, which is an important first step towards structured treatment of people who are dependent.